So hi friends, today's our topic is organophosphate poisoning, which is the OP poisoning. So what is the OP poisoning? First of all, that there are organophosphates and organocarbamates and organochlorines, etc. etc. Most important is organophosphate. Example include malathion, parathion. In the same way, there are carbamates also. Example, if you want to remember, it is carboryl and proxur. There are organochlorines also. Example, DDT. But main we will discuss organophosphate. So organophosphate are very highly toxic and it is used in pesticides. So in agriculture setting it will be used pesticides, and the main property of it is that it can cross the intact skin because it is a highly lipid soluble substance. So we see this kind of OP poisoning cases mostly in the like agriculture environment, like you can say farmer. Okay, so we will see this kind of cases in the rural areas. Barabar? Okay, now the patient will present with which symptoms. For that we have to learn about that how the this organophosphate works, mode of action. So they are acetyl choline esterase inhibitor. And what is the function of acetyl choline esterase? Acetyl choline esterase will break down the acetyl choline, and acetyl choline is responsible for the parasympathetic system. So acetyl choline esterase will be antidote of parasympathetic system, and this organophosphorus are inhibitors of acetyl choline esterase, so it will indirectly parasympathetic system stimulators. Okay, so and this is kind of irreversible inhibitor, irreversible inhibitor. So we have to remember all that. Now what, with which symptoms the patient will present to us? So the symptoms and sign, so we don't have to mug up it, we have to know that parasympathetic system will, we know that parasympathetic system will depress the heart, will depress the heart and stimulate other systems, we know this. Okay, so what will be the symptoms? So depress the heart means there will be low heart rate and low blood pressure. Okay, now it will stimulate other systems, so there will be hyperacid secretion in the stomach. So hyperacid secretion in the stomach, there will be urine outflow, increase in the urine outflow, we can say it will be urinary incontinence. We will have increased GI motility, due to which we will have diarrhea, and we will have constriction of the respiratory tract. So we will see like bronchoconstriction. So the patient will come with the asthma like symptoms, patient will come with the breathlessness, wheezing, etc. But the most important and the most commonly asked question in this topic is the pinpoint pupil. Pinpoint pupil. So we know that the parasympathetic system will cause the severe meiosis. So we will be having the pinpoint pupil here, which is very important and very characteristic finding of the patient. The patient will be having very pinpoint pupil, you can say minute pupil. Okay, so these are all the symptoms. And one another, we have to remember that the secretion will be increased secretion. There will be excessive sweating. So these two symptoms, the pinpoint pupil and excessive sweating, you have to remember this is the most commonly asked symptoms. Now we will directly come, there can be the muscle weakness, etc., but we will not go in deep about that. Now we will come to the treatment. So in the treatment, these all are the parasympathetic system stimulators. They are acetylcholine esterase inhibitor. So what we will give? We will give the atropine. What will atropine do? Atropine will be act as a you can say antagonist of the M1, M2 and M3 receptor, the parasympathetic system. So atropine will be given. How it will be given? So it will be dose and route. So dose and route, it is also important. So route is IV, simple, because it is emergency kind of condition, we have to treat it immediately. So route is IV, and we will give the dose of atropine every 5 minutes till the sign of atropinization occur. This is another important MCQ, we can say, or keyword. So what are the signs of atropinization? So there are some signs via which we can say that we have controlled the poisoning, we have controlled the case. So what will be the sign? So most specific sign we will discuss, but before that we will discuss the most common sign which can be seen by a layman also, which will be mydriasis. The patient will come with severe meiosis, but when we give atropine as a treatment, the patient will start showing mydriasis. So it is the most common sign of atropinization. Second sign, which is the most specific, most reliable sign, it is the decreased secretion. So we have marked two with a highlighter, and these two, reversal of these two will be the sign of the atropinization. And you can include one more, which will be heart rate will be more than 100. This is also, but these two are mostly important. So mydriasis and decrease the secretion. Now we have completed atropine poisoning, OP poisoning, and drug of choice is atropine. But we know that they are irreversible inhibitor of acetylcholine esterase enzyme. So we will give one more drug in the case of only atropine poisoning, not in the case of we will give it only in the case of organophosphate poisoning, not in the case of carbamide poisoning. And they are important drugs which is called acetylcholine esterase reactivators. Acetylcholine esterase reactivators, and there are two examples you have to remember. One is PAM, another is DAM. Full form: PAM, paralleloxime, and DAM, diacetyl monoxime. Now these two drugs are important, but they are not DOC. DOC, we are having atropine. So what will they do? They will improve the condition after the sign of atropinization has occurred. Okay, but we have to remember certain things, that it is only for the OP poisoning, not useful in the organocarbons poisoning or organochlorine, or even organochlorine is treated conservatively. There is no need of atropine also. So it is only for OP poisoning, not for carbamates. This is one point. Second point, you have to remember that P here stands for, like, for pneumonic kind of thing. We have to remember it will act only peripherally, not centrally. It will not act centrally. And DAM, die we can say 2 for pneumonic kind of thing. So it will act centrally as well as peripherally. Centrally as well as peripherally. Okay, so it is also incompleted in the this is all about the OP poisoning, you have to remember.